North Dakota nurses are hitting their breaking points as COVID-19 continues to surge through the state. An infectious disease specialist at Johns Hopkins says he believes North Dakota's virus trajectory officially puts it in crisis, saying the state is, quote, a lesson for what happens for when you don't plan for cases. Valley News Team's Bailey Hurley spoke with a nurse today who tells us nurses across the state are only holding on by a thread.
Although Sanford Health denied the allegations, several Sanford nurses tell me over 70 traveling nurses have ended their contracts in Fargo early due to what they cited as poor working conditions. One former traveler saying she left after 3 weeks due to little staff and, quote, unsafe conditions.
That's scary. I mean, that's definitely, it almost gives me goosebumps. That's not the reason we want to be in headlines.
Less hands on deck has left ICU and COVID unit nurses with double or triple the amount of patient loads.
That's concerning. As nurses, we just generally want to give our all and do our best with safety and care and compassion. And when you're spread so thin, that's really difficult.
In an effort to fight against staff shortages, Sanford nurses have been told they must pick up 36 to 72 extra hours between now and Christmas Eve, a decision Johnson says is only going to lead to burnouts.
We cannot just be run to the ground.
Elective surgeries already on the books continue at Sanford, a move Johnson says many Fargo nurses say, quote, disgusts them.
There's only so much you can take. There's only so much you can put your life and your family's life and your children's life and your own well-being at risk day in and day out.
In an email Monday, Sanford Health says they activated their next stage of their surge plan, adding 35 more hospital beds with an additional 14 rooms under construction.
Why didn't they communicate that to their staff 9 months ago? So when now we're in this crisis, they could have known what to expect.
Johnson says in 8 months, Governor Doug Burgum has not reached out to anyone in the state's nurse association, which she says makes nurses feel unvalued and unappreciated. In Fargo, Bailey Hurley, Valley News Live.
Despite Governor Burgum's announcement earlier this week, both Sanford and Essentia Health say that any employee who tests positive for COVID-19 must quarantine for a minimum of 10 days and is not to report to work.